Hey everyone, we are back and we are actually closing up our series this month all about allergies. So today we're actually focusing a bit more about talking about allergies that are more related to chemical allergies, or also known as chemical sensitivities, and also how we develop certain allergies that we have to different types of medications, prescriptions, or even antibiotics. So when it comes to, the overall immune function and the immune reaction that occurs that triggers different types of allergies, it's a very similar cascade that's happening, but there is a very different root cause or exposure when it comes to how we develop sensitivities to chemicals as well as to different types of medications. So today's focus is more so understanding how we become chemically sensitive. And for those of you that are kind of unsure of what that actually means, it's more so the people that are really struggling with the sense of different types of fragrances. They can't wear perfume anymore. They're having a lot of issues with different types of personal products, everything from shampoos, conditioners. They're having reactions to different types of detergents that are being used on their clothes, or they can't dry clean their clothes anymore. So there is a variety of different reactions that we can have that really don't necessarily come back to, say, the material, but it comes back to the chemicals that are on the material or the chemicals that are in the personal products that we are using. So as we start this conversation tonight, we're really going to understand a bit more about how does this start in the first place, and what are some of the things that we can do about it, and what are the things that you are not always being told to connect the dots as to why you've become chemically sensitive. Because when it comes to these chemical sensitivities, these are on the rise and people are reacting to a variety of different things. But what I find the most fascinating is the people that come through my doors, they don't always know that they're chemically sensitive. They know that they're having negative reactions and they may have been diagnosed with an autoimmune condition. But then as we dig deeper and ask better questions, it actually turns out that they're working in a profession that is actually exposing them to a variety of different toxins that are making them reactive. And honestly, one of the most common is going to be hairstylists and women that work in salons. There's everything from men and women that are working in construction, they're doing tiling work, mechanics, even people that are developing film. So there is a lot of different professions that are actually connected to the development of these chemical sensitivities. But in addition to that, there is a lot of connection to a variety of autoimmune conditions and even I would say mystery symptoms. The people that just don't feel right, but don't always really understand what's going on in their systems. So just a little bit of a background on myself and Integrative Wellness Group, which is the practice that I own and co-manage with Dr. Nick. So we started this practice, it's crazy to say, but literally 9 years ago. And really since day one, we have been asking better questions and really always pressing the envelope with how we looked at our patients and also how do we work with our patients. And because we've always asked better questions, it really led us down a road of going from this more traditional type of functional medicine practice into a fully integrative practice. And what I mean by that is we kept hitting roadblocks with working with the diet, working with nutrition, working with supplements. And those roadblocks led to the evolution of learning more and understanding that there's an emotional side of things, understanding there's an energetic side of things, understanding that neurology plays a role, the physical body. And it's not always just about a good diet and supplements, because those of you that are probably listening right now, maybe you've been there, done that. Maybe you've taken a bunch of supplements. Maybe you went on an elimination diet. Maybe you did a cleanse and you felt okay and then you hit a plateau. So we hit those plateaus and it kept us really digging deeper, but we also always thought beyond systems. And what I mean by that is it's not about picking apart the body and thinking that, oh, it's just about the gut and I just have irritable bowel syndrome and I have depression. Those two things very much can be connected. And I'm not going to say they're connected in every single patient, but what you need to understand is that your body is a whole integration of systems that are constantly affecting each other and constantly communicating with each other. So that's really why I classify myself at this point an integrative physician. And I work with a variety of different types of people. Allergies is definitely one thing that I see very often in my practice. But I will tell you this, is I do not see allergies that live by themselves. I don't see a patient who I'm just like, you just have allergies and we're just going to deal with allergies. These allergies are always being triggered by something else, some foundational issue or root cause. And that foundational issue very often is going to be some type of toxicity or a toxicity that is creating an immune reaction. And when it comes to those of you that are chemically sensitive, you cannot tolerate the smell of a perfume. You cannot tolerate the smell of cleaning products. You cannot tolerate different detergents, lotions, or other types of skin products. You can't tolerate those things because you're toxic with those types of chemicals. And I know that might sound crazy, but as I continue this presentation, what you're going to understand is it's not difficult to get exposed to these things. It's not difficult to become toxic with these certain types of chemicals. So in addition to my day-to-day job of working with patients, a recent accomplishment that's really exciting is the launch of the Institute for Integrative Wellness. This is something that I feel so passionate about because for those of you listening right now, you know, most of the people that listen to my webinars or are on Instagram Live with me, you know, I get a lot of outreach after this and people are like, oh my gosh, that made so much sense. I'm so happy that I found this. Like, you created so much clarity for me. This was, you know, so life-changing and I'm so excited about what lies ahead. And I really want other physicians to be, you know, looking at the body from an integrative perspective and really understanding all of the things that I've learned over the past 10 years. And that is what the Institute is all about, is sharing that, because we need doctors to be stepping up and understanding why their patients are sick, why they're hitting roadblocks with their treatment protocols, and what are the aspects that are missing in order to really revolutionize healthcare. So with all that being said, you might be thinking, well, how did you get into this? You know, why do you do what you do? And I remember in school feeling somewhat guilty about the fact that I didn't have that story. I didn't have the story that I was super sick and I was a mystery to conventional medicine. And then eventually a functional medicine doctor, you know, figured it out and I was able to get better. I was actually the polar opposite. I felt like I was pretty healthy. And when I did my testing, I almost did my testing thinking that everything was going to come back perfect because I was the picture of health. And in my mind, I was the picture of health according to what I knew at that time. And when my testing came back, I realized that I actually had a lot of issues. And I had everything from mercury toxicity to parasite issues. Later down the line, I realized I had a lot of neurological involvement because of my gut issues started to affect my vagus nerve. So overall, I remember being a bit jarred in the moment, thinking like, oh my gosh, look at all these things going on. You know, is this accurate? And when I really was able to sit with it, what I realized is that so many of the things that I dealt with were my normal. Not having the best sleep was my normal. Getting bloated after eating was my normal. Feeling fatigued midday, needing a midday coffee was my normal. Having sinus issues was my normal. And most of those things are your normal as well. Most of the things that you're dealing with have become your normal. They're not even on your radar. And it's funny, I know this because when I sit across from my patient, I can tell they can't breathe. And I'm just like, how are your sinuses? They're like, fine. And then when we start doing our preliminary testing, we find that they do have sinus congestion, but they've had it for so many years, they don't know any different. They don't know any better. And a lot of things we normalize, some of the things we normalize we're aware of, some of the things we normalize we're not aware of. So a lot of us that have developed these chemical sensitivities, or we've developed these reactions to sulfa drugs, or we've created reactions to penicillin, amoxicillin, or other types of antibiotics, a lot of these things we're just like, oh, that's just me. I just need to avoid it. I need to work around it. I just need to tolerate it. And really, at the end of the day, we're not asking better questions to say why. Why does this exist? Why is this present? What caused it in the first place? Because it's an immune reaction. Why are you having an immune reaction? Why are you having an immune reaction to one antibiotic but none of the others? So is it that there's a chemical in that prescription drug? Is it that you have been exposed to that drug in a different form, which I'm going to explain that further in just a few minutes. So I know that we are 10 past 7. There are lots of things happening in our households. There are people that want dinner. There are dogs barking. There are probably emails that you're still checking and a variety of other tasks that you need to do to get ready for tomorrow. But give me the next 20 minutes of your attention, because I promise you it will be worth it, in the fact that I'm going to be talking to you about things that you don't already know. I'm not going to sit here and tell you that all allergies come from the gut and that all you have to do is go on an elimination diet and everything's going to be great, because it's not that simple. It's not that blanketed. It's not that black and white. So first and foremost, it is not your fault that you have no freaking clue as to why you have so many allergies. It is not your fault that you break out in hives every time you take a certain type of drug and you don't know why it's happening. It's not your fault that now you have to be the person that says, don't wear perfume around me because I'm going to get a splitting migraine or puke. So it's not your fault that you don't know how they happen, why they happen, and what to do about it. There is a lot of information out there. There's a lot of mixed information out there. This give me your attention, because I'm not going to sit here and tell you that everything starts in the gut. If one more functional medicine doctor just says how everything's about the gut, I'm going to rip my hair out. And I say that with love, but I used to be that person. And then I realized how much more there was to the story when it comes to why these allergies develop in the first place. So another big aspect to understand before we really start to talk about these chemical allergies and why they exist is that when we start to think about allergies, again, it's not that when a person comes in, they come in with allergies, they're just an allergy patient. That's not what it is. These people have an immune system that is being triggered, and it's being triggered because of something else that's going on in the body, or maybe more than one variable that's going on in the body. So a lot of this comes down to really understanding how all of the systems work together and not separating out the gut from the brain and the brain from the heart and, the immune system from the lymph nodes. It's really understanding that everything is working synergistically together. And, the biggest mistake that we make is that we segregate out the systems, and then we don't always understand that there is going to be a cause and effect. So if you're a person that has depression, but you're also a person that maybe has low-grade gut issues, maybe it's mild, maybe you just have, occasional bloating gas, maybe you have a low-grade irritable bowel syndrome, maybe you have a full-blown Crohn's disease. But those gut issues are going to start compromising how well you produce certain neurotransmitters. It's going to compromise how well you produce serotonin. It's even going to compromise how well you produce GABA. So pretty much serotonin is that feel-good hormone that gives you joy, that allows you to feel happiness. And then your GABA, I call it the anti-anxiety hormone. It's what calms you down and keeps you out of this fight or flight state. So if you have a lack of both, you're going to feel anxious, you're going to feel depressed, but it's not because of a psychological issue, it's because of a gut issue. So we really need to start understanding that you could easily be trying to support something, but you might be supporting the effect and you might be completely overlooking the cause. So at this point, we need to be our own health advocates, because not every physician is educated in this way to understand how it all works together. And it's because these systems are complicated. Understanding the, urinary system and the kidneys inside and out, there's a lot of pathology associated with one organ system. So I understand why we've segregated everything out, but it's also allowed us to run into roadblocks as to why there is such a lack of, cures, and there's a lack of effective treatment nowadays. So a couple of really fascinating things about allergies as a whole. So number one, allergies, including chemical allergies, can start in the womb. When you actually start digging into the research and you start looking at the testing they've done on the amniotic fluid. So the amniotic fluid is the fluid that the baby is essentially floating in through the duration of the pregnancy. So they have found upwards of 172 different types of chemicals in the amniotic fluid, aka in the home of your developing baby. One of the primary things that was found in 30% of the samples was DDT. DDT is an aggressive, harmful type of pesticide that they have told us they stopped using in the 70s. But there is still traces of it found in amniotic fluid. There's traces of it found in certain bodies of water. It's found in soil. It's found in so many more places than you realize. So when we talk about, these chemical allergies or these kids that are developing these neurological conditions at such young ages, this literally can be starting in the womb. This is not necessarily about what happened to your baby after they were born. In addition to that, when we're talking about environmental and medication allergies, that one of the biggest reasons for mold toxicity or antibiotic allergies, or I should say mold allergies or antibiotic allergies, is due to mold toxicity. Yes, glyphosate is found in the fluid as well. So for those of you that are watching and don't know what glyphosate is the primary active ingredient in Roundup. So Roundup is something that is being used heavily in farming at this point in time. And glyphosate is such aggressive is not the right word, but it's such a potent type of chemical that once it gets into the body or gets into tissue, it's actually very difficult to get it out. And what's very fascinating for those of you that are listening right now that have maybe gone down the functional medicine train, and maybe you have done a stool sample of some sort and you've had your microbiome of your gut checked, you may have found that you had a lot of abnormal or high levels of abnormal bacteria or dysbiotic bacteria. So maybe you had high levels of E. coli, maybe you had high levels of salmonella, maybe you even had Clostridium difficile at one point. That's the type of bacteria that causes like chronic diarrhea and can actually be fatal. So maybe you had all these levels of high levels of bad bacteria, but you were bottomed out in your probiotics, which is the good bacteria. So if you had that seesaw of too much bad and not enough good, one of the primary causes of that is actually glyphosate that has made its way into your gastrointestinal system from the food that you are consuming. And they've actually proven this at this point, that the two specific strains that are going to be very elevated is Salmonella and Clostridium species. So you might be working with someone and trying to clean up the gut, get rid of the bad bacteria, kill off your small intestinal bacterial overgrowth, and you keep running into roadblocks and you keep getting so frustrated because you're just like, I'm doing all the right things and I cut everything out and I'm gluten-free, dairy-free, this, that, the other thing. I'm taking all these supplements and I still feel like crap. And it's because you actually have a toxic gut. It's not because it's all about the bacteria. So we need to start understanding that toxicity is a huge player in this day and age, and it is not something to be overlooked anymore because it's being overlooked all the time. And when it comes to this whole mold conversation, I literally have done quite a few webinars elaborating on this topic of mold. But when you have an allergy to penicillin, amoxicillin, ampicillin, or you get skin prick testing and they tell you you're allergic to dust or mold, you have to understand that you have to have toxic levels in your body in order to create an immune reaction, which would then cause the allergy. So some of the primary ways that we are being exposed to mold is through food as well. So there are many, many things that we are eating that naturally get infected with fungus. So wheat, corn, grains, rice, like all of these different types of crops are actually growing, being infected with fungus. The fungus is not being monitored, and these foods are just going right into the food supply and making its way into your grocery stores. So if you think that you are mold-free, chances are you are not, because it is way more prevalent in the food than you realize. And this is definitely going to be a culprit behind why you might be reacting to certain antibiotics, and also might be why you have a mold allergy. The other thing too is when it comes to antibiotics, I definitely find that that is one of the primary prescriptions that people have allergies to, that cause eczema breakouts, hive breakouts, even throat closing situations. But there are a lot of other medications that people will react to. And the thing is sometimes it's not necessarily about the active ingredient in the medication, but a lot of times it's about the inactive ingredients. And the inactive ingredients in these medications are things like red food dye, blue food dye, gluten. So those of you listening right now or know someone on thyroid medication, Synthroid specifically, Synthroid has gluten in it. I cannot tell you how many people either come to me and say, I am celiac, or we test them and find out that they have celiac and they've been prescribed Synthroid, and their endocrinologist doesn't even know that it has gluten in it. So we really need to start looking at the inactive ingredients in these medications, because that might be a culprit for why you're so tired. It might be a culprit for why you have seasonal allergies. It might be a culprit for why your stomach hurts. It's very, very much can be the inactive. Two is about these chemical allergies. For the people that are listening that are super sensitive to perfumes, you're super sensitive to cleaners, bleach, and other types of chemicals, you have to understand that this is not necessarily just about being an allergy, but these types of reactions actually affect the cranial nerves, which means that you are having a neurological reaction to these different chemicals. It's actually called vasomotor rhinopathy. So when you're having a overactivation or a negative trigger to the olfactory nerve, which is the cranial nerve that controls your smell, that can be triggered by these chemicals, but it's actually creating a negative response to the brain. So when you have these chemical allergies, we need to start thinking bigger. We need to think about, is this actually affecting your neurology? Is this making you have brain fog? Is this making you lose your memory? Is this making you susceptible to conditions like multiple sclerosis or Alzheimer's or dementia? So we are living in a world that those conditions are on the rise. There are so many people struggling from a neurological perspective. Ask your friends, literally. Everyone feels like crap. Everyone's tired. Everyone's foggy. I have people in their 20s that literally cannot remember what they ate 2 days prior. And, it's crazy. I was in Huntington Beach a couple of weeks ago, and yes, I was at a bar. I do drink cocktails occasionally, but when I was there, I literally was going up, I was ordering a glass of wine, and there was a girl that came up next to me with her cell phone. And it's pretty normal for everybody to have cell phones out nowadays, but she had her cell phone out because she couldn't remember her friends, because she had 2 friends with her. She couldn't remember what they wanted. She literally walked 10 feet and she had to put the drinks that they wanted in her phone because she could not remember what they wanted for walking 10 feet. And this girl had been in her 20s. And I was just like, that is so scary. That is really, really scary. Typical Cali girl. I know you're from the East Coast now. That is definitely what you think when, unfortunately, you live on the West Coast. So when it comes to the prevalence of what's called multiple chemical sensitivity, it's actually increased by 300% over the past few years. So that's an astronomical number. So this is something that is definitely on the rise. And, is it because we're becoming more reactive, or is it because we're using more chemicals? It could be both. It's definitely not going to be one or the other. But some of the biggest things that people are reacting to is going to be cigarette smoke. I cannot tell you how many chemicals I see come up in people's testing that are all from cigarette smoke. And these are not people that necessarily smoked. These are also people that were exposed to secondhand smoke, or unfortunately mom, back in the 60s or 70s didn't know any better and was smoking while she was pregnant. So there is so much that can happen literally just in the womb based off of the chemicals that were in mom's body that eventually made their way into the amniotic fluid. So there is everything from gasoline to exhaust. And this is not meaning like you're huffing the gasoline fumes from your car, but a lot of it has to do with the contamination in the ground. We live in lovely New Jersey, and I grew up north. And when you literally drive, 20 or 15 miles outside of where I grew up, there's Exxon has massive gas tanks everywhere. So it's like, these are things that, how can we think that they're not getting into the water supply essentially? And definitely the big one is the pesticides, the herbicides, the fungicides, and the Roundup, the glyphosate chemical. These are in high abundance at this point. Literally, this is something that we are all being exposed to. And unfortunately, they're finding that even there's some contamination in even the organic foods. So it's so important to try to even work with your local farms, because when we literally see organic from Mexico and organic from, South America, I'm sorry. When I lived in California for a short amount of time, we had a couple of trees in the back, but one of them was a peach tree. Literally, I went and picked peaches off the tree one day, brought them inside, and within one day they were moldy. And it really opened my eyes to think like, okay, if something is organic, making its way all the way from Mexico, that's a high or a long transport. Like there has to be something that's being used in order to preserve that to some capacity. So, electrical sensitivity is one of the questions, like what about electrical sensitivity? So electrical sensitivity is actually really common with mold toxicity. I don't want to discredit that heavy metal toxicity can be part of that as well. But one of the things that happens when you have mold toxicity is it affects something called your antidiuretic hormone. Your antidiuretic hormone is the hormone that allows you to hold on to your hydration. It also allows you to hold on to your electrolytes, salt being one of them. So when you get exposed to mold and your antidiuretic hormone is not working properly, you tend to lose a lot of your electrolytes through your urine. You also lose electrolytes through your skin. So salt being one of them. So salt is an electricity conductor. So you will find that you get electric shock very easily if you're turning light switches on and off, or if you're plugging things in. And you also get sometimes a phantom vibratory or buzzing feeling that you feel like your cell phone is on you vibrating, but it's not your cell phone. So that's a very common thing that happens when it comes to mold toxicity. And like I said, is certain types of metals like cadmium and aluminum, they can also further that response because they're also have conductivity properties as well. So another thing too, when it comes to what are people reacting to, a lot of this has to do with the different fragrances and chemicals that are in our soaps, colognes, deodorants, body creams. You would actually be horrified if you really started to dig into what is in most of these products. Last month, I actually did a whole webinar specifically on all the chemicals that are in our personal products. And really, the easiest thing that I can tell you guys to do is, it's funny. Someone said, I've had this buzzing and I thought I was crazy. One of the questions I ask in my consultation is I ask that question about the phantom buzzing, and people's faces change and they look at me like almost like, how did you know that? And they're like, oh my gosh, I can't believe you just asked me that, because I don't say it out loud because I feel like I'm crazy, or I feel like I sound crazy. But no, there is a legitimate reason why it's happening. It's not in your head, I promise you. But again, when it comes to these different types of chemicals, like the easiest thing you can do is utilize Think Dirty. It's an app that you can download onto your phone, and you can start taking inventory on the different chemicals that might be in your products that you're using. But I will tell you, your commercial brands, your Jergens, somebody talked about Pert Plus today, and I was like, oh my God, Pert Plus, I haven't heard that in forever. But yeah, like Suave and, all the big name brands, chances are they are containing some level of chemicals that are going to be hormone disruptors, number one, and also some chemicals that can be very compromising to the immune system overall. Yes, the EWG app is also amazing, the Skin Deep app. So both Think Dirty and the Skin Deep app are two fantastic resources. So outside of that, when it gets into like other different chemicals, everything from your hair dyes, personal products, formaldehyde is huge. Those of you getting your lovely keratin, Brazilian, whatever treatments in your hair, making it soft and straight and beautiful, those contain high levels of formaldehyde. You're getting your nails done, acrylics, literally the list goes on. There are tons and tons of chemicals that we're being exposed to. But one thing I will say to you is that when we have these chemicals, like this is not just about risk for cancer. This is not just about, it's not just about developing allergies. This is also about preserving your neurological system, because it is alarming how many people that I'm working with that are coming in with already diagnosed neurological conditions. But number two is I'm observing the neurological deficits. I'm observing patients that cannot remember what I say. I'm observing patients that have massive anxiety. I'm observing patients that are literally just, they can't even literally remember to like lock their doors when they leave their house. And it's becoming, scary is happening. And when it comes to these different toxins, the biggest thing that's happening is it's compromising the overall body. So your body is equipped to detox. It is fantastic at detoxing, but it gets to a point that the filters are full and they cannot do their job anymore. We're equipped with tonsils, we're equipped with a spleen, we're equipped with liver, we're equipped with the gut, we're equipped with kidneys and a boatload of lymph nodes that are literally from the top of our head all the way to our toes. Every single one of those systems and organs are designed to help us detox. But if you get exposed to, say, a bunch of pesticides and herbicides and crap because you eat a bunch of processed food, then your liver is going to get clogged up. Or maybe you drink a bunch of alcohol or take a bunch of Tylenol, your liver is going to get clogged up. Then your kidneys have to work harder and your lymph nodes have to work harder. Or then maybe you lived in mold and now your lymph nodes got clogged up. Now your liver and your kidneys have to work harder. And then they all start to become compromised over time. And we all call it aging. You hear it all the time of, oh, I'm getting old now. I used to be able to like go out and, have like party and have a bunch of drinks and I could wake up the next day and feel fine. And now I have a glass of wine, I'm hungover for 3 days. Well, the reason that's happening is because your body's ability to filter out and metabolize the alcohol is not working anymore. And it's not that you're old, it's not that you're broken, it's just that you have to take into consideration, you can't keep, essentially using the vacuum and never dump the filter. You need to eventually dump the filter. So when we start to have all of these systems compromised and clogged up, this is when we're starting to get a lot of these chemicals starting to affect our neurological system. And for those of you that have had tonsils removed or have giant tonsils, chronic sore throats, or you have those lovely tonsil stones of those gross white things that pop out of your tonsils, those are all signs that your tonsils are overloaded with the garbage that your brain is trying to detox out. Your brain has a whole mechanism to help you detox, but all of that crap gets dumped directly into your tonsils. So if you have chronic tonsil problems or your kids have chronic tonsil problems, chances are they have toxicity in their body that their brain is being completely overloaded with. So one of the examples that I've kind of already talked about for those of you that are new jumping on is that a lot of people are struggling with allergies to different types of medications, and a big one being antibiotics. Oh, I took penicillin, I broke out in hives. Oh, I took amoxicillin, I had eczema. Oh, I took ampicillin and my throat closed or my tongue got weird. So when we are talking specifically about these antibiotics, most of them are derived from mold. So penicillin is called penicillin because it's derived from penicillium, which is a mold. So a lot of our antibiotics are derived from mold. So if you have toxic mold in your body, maybe it was because mom had toxic mold and you got exposed in the womb. Maybe it's because you had a boatload of antibiotics because you had ear infections as a kid. You can get the toxicity from overdoing antibiotics. You can also get it from living in a moldy environment, etc. So if you have toxic levels of mold in your body, that is what's going to trigger the immune system. The immune system creates a memory, and then when you take that antibiotic later down the line, you're going to have a reaction. So very often when we have toxic mold in the body, we also tend to react and have seasonal allergies. The seasonal allergies are primarily coming from the fact that under a microscope, mold, pollen, dander, it all looks really, really similar. So they're very cross-reactive. So we tend to have worse seasonal allergies when we have toxic levels of mold in the body. So first and foremost is it's not just an allergy. You don't just have an allergy to antibiotics. You don't just have an allergy to food. You don't just have an allergy to these chemicals. These different allergic reactions are showing an immune response. They're also showing a neurological response. So like I said before, is that if you have issues with chemical smells, different types of bleach, again, like different types of chemical triggers, this is showing you that you are actually having a neurological response. So we need to start thinking bigger about why are you having that response and what is this going to look like in the long run. The other big thing that can make us more susceptible to these different types of chemical allergies and reactions. I will give you an example. The women that wear the cheap jewelry and it stains their skin. Most cheap jewelry is made from nickel. And when you have that skin color change, it's because you have an allergy to the nickel. One of the biggest compounds that we are being exposed to in reference to nickel is dental. So there is nickel in your braces, there is nickel in sealants, there is nickel in your permanent retainers they put behind your teeth. So it's not always about fillings in the teeth, but braces, retainers, sealants, bonding. A lot of the things that are being used in dentistry actually can trigger the cranial nerves, which triggers the brain, triggers the immune system, and causes us to have these heightened responses and have these chemical sensitivities. So we really need to start thinking about how does our dental issues or our oral issues play a role in our overall body. And I've had to learn this over time because it was something that I didn't understand in the beginning stages of my practice. I didn't know that the fact that somebody had a dental abscess or a bacterial infection in their mouth, 10 years prior, that actually could have created a systemic response, which then led to an autoimmune condition. So I cannot tell you how many people that when we ask better questions and we take a dental history, that a lot of their symptoms started around a time that they had some type of dental procedure. So we need to definitely take that into consideration when we're looking at the big picture of your overall health. So another big thing too is that we kind of think that maybe only certain populations are affected by these chemical allergies. We assume maybe it's only people that are working with chemicals. It's only the people that work, in construction, or it's only the people that work in factories or things like that. But we also have to take into consideration, where do you live? Where do you live? Because we live in the lovely state of New Jersey, which I've lived many places and I did come back, so I love it dearly, and I will manage the toxicity. But one of the really fascinating things about really the world in general, but New Jersey particularly, is that we have in New Jersey, well, I should say all over the country, we have things called Superfund sites. And the Superfund sites are actually, they're areas that have been contaminated with nuclear waste that have a government ordinance to be cleaned up. So when you think about New Jersey's size in reference to California, Wyoming, Utah, these states are huge in comparison to New Jersey. And most other states have anywhere between 1 to 2 to maybe up to 5 Superfund sites. Again, nuclear waste sites. New Jersey, anybody want to take a guess how many we have in the little state of New Jersey of literally places that have nuclear waste issues? We have 126. So this is extremely, extremely alarming, because it's not just us. We also have New York that's being affected. California, everybody thinks California is like wellness central of the world, but they actually have the second most Superfund sites. So we are talking about a boatload of toxicity that we are being exposed to just based off of where we live. And unfortunately, not everybody knew about water purification systems. Not everybody knew about, not swimming in certain bodies of water that are contaminated. We didn't always know about these things. So this is part of the puzzle that has given us these exposures, which has created some of these chronic illness issues, mystery symptom issues, but it's also created issues with these chemical allergies and reactivities. So the other thing too is you might be thinking, well, I'm not a candidate for any of this because I'm sure that this would have came up in my testing. This is not going to come up in your physical. This is not going to come up in your CBC or your CMP, which is like general blood work that's being run on an annual basis. Like, nobody's testing for these things. You have to specifically go out of your way to work with physicians that understand this in order to really be able to evaluate this. Steph, I'm sorry that it was not working, but definitely direct message me your email and I will make sure that I get you the replay. So I don't know why the webinar wasn't working. It's a little quirky sometimes, but I'm glad you're here. So the other thing too, when it comes to the actual testing that's going to give you insight, is one of the tests that's out there is going to be GP Tox. It's Great Plains. So Great Plains can definitely give you insight on glyphosate, which one of our viewers was mentioning. So the glyphosate toxicity is something that really a lot of us need to be evaluated for. In addition to that, it gives us insight as to a variety of different chemicals that half of them you probably have never even heard of, but chemicals that we're being exposed to through our environment, through our personal products, and through even our drinking water. The other thing is we need to be leveraging better testing for heavy metals. I used to do a lot of more traditional tests. I used to do hair analysis for heavy metals, and I used to do urinary tests. I have actually completely shifted gears, and I use a very advanced technology called spectrometry to evaluate for intracellular heavy metals. This is everything from aluminum, mercury, cadmium, strontium, literally silver, nickel, the list goes on. But even outside of that there are tests out there that allow us to test for prescription reactions. A lot of this is not being utilized because of cost. But if you are someone who is toying with the idea of chemotherapy, you really should be seeking out labs to know, like, is this chemotherapy congruent with your body? Is it something that's going to cause a negative reaction? Is it even going to work? The RGCC is a lab out of Greece, and they're one of the best labs for knowing which chemotherapies best coincide with the body. But outside of that, when it comes to the other testing is we need to test for heavy metals, we need to test for chemicals, and we also need to test for mold and mycotoxins. So when it comes to mycotoxin testing, I've been using a lab called Vibrant America. I find that they are definitely one of the best for being able to give us insight with that. There are other labs out there, but after using a variety, I definitely feel that Vibrant America is one of the best at this time. So some of the preliminary tests that we use in our office is we use some really advanced technologies from Europe. One of them is actually called the bioresonance. The other one is an American technology called the bioscan. So both of these work in different ways. One is actually working, down to the DNA level and looking at what types of chemical reactions are damaging our DNA. And then the other one is actually looking for different types of allergic reactions within the body. So these two technologies are amazing as we bring the information together, because it allows us to really understand not only what your body is reacting to, but how, like, what problems is it causing in your body? Is it affecting your liver? Is it affecting your energy? Is it affecting your sleep? Is it affecting your digestion? And that's really some of the amazing things that we see is we're able to get extremely specific when really knowing like what is doing what, but also that helps us to know how we can actually get you on track to feeling better. So I mentioned this earlier, but for those of you that are just hopping on, the other thing too is that some people do have reactions to certain types of drugs, and some people even have reactions to supplements. And it's not always about the active ingredients in those prescriptions or the active ingredients in those supplements, but a lot of it is the additives. And when you're dealing with supplements, definitely supplements are going to have less additives. I would say the one additive to be aware of in supplements is magnesium stearate. Magnesium stearate has actually been found to be reactive in some kids with pandas or even autism. Not every, but it's definitely something to be aware of. But when we're talking prescription drugs, we're definitely talking about a lot more additives. We're talking about dyes. Red and blue dyes are two of the primary. We're talking about aluminum. That is very, very common in a lot of prescriptions. We're talking about gluten. So again, I said this earlier, for those of you on Synthroid or you know someone on Synthroid, Synthroid is a thyroid medication. It has gluten in it. So if you're celiac or gluten intolerant and you are taking Synthroid, you are potentially causing an immune reaction every time you take your medication. So in addition, formaldehyde is in furniture. It's in your carpets. It is in different building materials in your home. It's in your hair dye. It's in your hair straightening materials. It's in a ton of personal products. We have benzenes. Benzenes are in everything from dry cleaning agents, detergents, different cleaning agents, personal products. Propylene glycol is actually a derivative of antifreeze. Propylene glycol is in every single one of your personal products. I'm going to tell you that right now. Unless you've swapped everything out to be natural, start taking a look. You're going to find propylene glycol in almost every single product. Your deodorant, your shampoos, conditioners, your lotions, your mousse, your hairspray, it's in everything. And it is extremely toxic, hormone disruptor, carcinogenic. The other thing you're going to find in a lot of medications is high fructose corn syrup. So, we're trying to avoid sugars because maybe we're diabetic or whatever else, but we might be taking a medication that actually contains it. So again, the point of this is that we need to start looking at the ingredients of the things that were being recommended, because we might actually be trying to fix one problem by taking the medication or the supplement, but we might be causing a completely different problem because we're exposing ourselves to different chemicals. So it's just seasonal allergies. This is always a conversation I have with my patients, and they're always like mouth drop, like staring at me like, what? But when you really take a step back and you think about your seasonal allergies, so what's happening at the change of seasons? So change of seasons, you kick on your air conditioning unit. Maybe there's a bunch of mold in your air conditioning unit. Maybe there was condensation. It was sitting pretty much all winter long, and maybe you're pushing mold spores through the ventilation system of your home. Maybe you're pulling clothes out of the basement because, you know, you're bringing out your winter clothes or you're bringing out your summer clothes. Maybe there was mildew or condensation or some type of moisture in your basement. Maybe you're using more sunscreen because you're getting into the summer months, or you're using your makeup with SPF that has chemicals in it. Maybe you started landscaping and you're using a bunch of pesticides and herbicides, and you're using fertilizer and you're spraying for mosquitoes. Maybe you're landscaping, cutting down trees, trimming bushes, and those trees or bushes are infected with fungus. Maybe you're spraying, you know, your property for mosquitoes or ants or other things. So we need to start thinking about, like, is this truly a seasonal allergy, or is this actually a chemical allergy or a mold allergy based off of other things that we are doing either in our homes or on our properties? So it's very, very important to take all factors into consideration, because you might actually be completely missing the boat on what is the true problem here. So I had a patient who, she actually really didn't know that she had chemical sensitivity, but by the time she showed up to my office, she was diagnosed with 3 autoimmune conditions. Another thing that came up in conversation was like the massive fatigue and brain fog that she had. Her brain fog was pretty debilitating. She actually had to write everything down because within a few minutes she would actually forget it. So she came in to really have another modality to deal with her Hashimoto's, her celiac, which then she also ended up being diagnosed with lupus at one point as well. So in conversation, it turned out this woman was a stylist for over 20 years. And when she said that, I couldn't help but feel, okay, is this, you know, really just, oh, you just have autoimmune conditions? Or is your immune system literally on fire because of massive chemical exposures? So this woman really had the double whammy. She not only had a buildup of tons of chemicals from formaldehyde to propylene glycol, lead, mercury, which a lot of it came from all of the products that she was using in her industry. But the kicker was that in addition, the salon also ended up having a mold problem. So there were actually various people that were in the salon complaining of fatigue and brain fog issues. And for her, the big thing that happened was that, you know, that was like the straw that broke the camel's back. She had this accumulation of all these different chemicals in her body. And then once the mold was part of the puzzle, because it was black mold, which is very, very aggressive, that was literally, her immune system was like, I'm done. Like, I can't. And her immune system kind of threw in the towel. And at that point, you know, there was the development of these autoimmune conditions. So just so you understand as well, is that when it comes to Hashimoto's and the thyroid, or just thyroid in general, when you really think about the anatomy of where the thyroid is located, and you think about if somebody is breathing in mold spores or breathing in formaldehyde or breathing in, you know, some other type of chemical, like you think about a salon, they're spraying a million things. Like I like die when I go to the salon. I like go once a year because I can't even handle it. But they're breathing all of that in, and it's going into the sinuses, it's going into the mouth, it's going into the tonsils, and what's just chilling right in the middle is the thyroid. So you get all these chemicals saturated into the sinuses, saturated into the tonsils, saturated into the lymph nodes, and this is going to be, you know, almost like the thyroid is in a bad neighborhood. It's literally sitting in the middle of all of these tissues that are ridden with the toxicity. And the same thing goes is that breathing it in, getting into the tonsils, the mouth, this can also then allow these chemicals to get into the digestive system as well. So when you talk about your gut and you're like, what did I eat today? Oh my gosh, like, am I reacting to this food? Am I reacting to that food? It might not be food. It might be chemicals. It might be something completely off of your radar. Most of my patients that have come to me after years of gut issues, it's yeah, they have bacteria, yeah, they have inflammation in their gut, but they also have a boatload of toxins in there. So once we're able to tackle the toxicity, they actually have the resolution of their gut issues. So it's just really important to understand there might be more to the story for the symptoms that are unresolved for you. Just so you know, Instagrammers, this is going to kick me off in about 5 minutes. So if you guys are enjoying this and you want to see the rest of the webinar, I can definitely shoot it to you in an email. You do have to direct message me your email address. So just know that you can definitely shoot me a message. If you have any questions right now, throw them into the comments section. Otherwise, direct message me that email address. Okay, so another big one is that allergies are not a reflection of your overall health. This is a huge myth because we often think allergies are just allergies and they are not associated with anything else, but chemical sensitivities are reflective of a neurological reaction that you're having. The longer your neurological system is stressed, the more inclined you are to have the brain fog that turns into the short-term memory loss, which turns into the word recall issues, that then turns into the long-term memory issues, which then becomes something more serious down the line. So it's a progression that happens that usually takes years, but if you are in your 20s or 30s and you're already saying, my memory sucks, you need to start doing something about it because it doesn't get better, it gets worse. The other thing too is that the immune system can become reactive for a variety of reasons. So again, this might be you're having a reaction to food, you might be having a reaction to mold, you might be having a reaction to chemicals, you might be having a reaction to heavy metals. It could be so many different things. But I do not want you guys to live in fear of your life. I don't want you to live in fear of the environment and think you have to live in a bubble because that is stressful. But when it comes to understanding the bigger picture, it might be more so that you need to just get your body's ability to be resilient back again. You might need to clean up those detox pathways. You might need to get your kidneys working better, your liver working better, your lymph nodes working better. And I will give you guys a disclaimer because for those of you who are like, what the heck does any of that mean? What does that even look like? So the person that is sensitive to caffeine, they can't tolerate alcohol, they're getting right-sided rib cage pain. That is problems with your liver. If you have constipation or diarrhea, or even occasional constipation or diarrhea, you're welcome. That is a sign that your gut's not working. That's in another elimination pathway. If you have chronic urinary tract infections, bladder pain, kidney infections, kidney stones, that is a sign that you have kidney issues. If you do not sweat, if you get water retention, if you're the guy with the skinny arms and the puffy belly, like what they call the beer belly, that is another sign that your lymphatic system sucks. If you literally have fibrocystic breasts, also known as dense breasts, that is another sign that your lymphatic system is not working. Guys, I know all of you relate to one or many of those. And we need to know these things because you're not just getting old, you're not just screwed based off of your genetics. This is happening for a reason, and it's not a hard fix. It's usually a pretty simple fix. So get better information because you don't know what you don't know. It's impossible for you to know these things if you don't do better testing, if you don't ask better questions, and you do not educate yourself. Because yes, Dr. Nick and I are here and our whole team is here to support, but at the same time, it really comes down to you also are in the driver's seat, and there's so much that you could do for yourself with the assistance and the guidance of physicians like us. So you guys got 2 minutes. So any questions or comments, throw them in. So a big thing that I always say is we just need to stop blaming this on bad luck and bad genetics. We need to understand that there is always a reason. There is always a reason. You're not just doomed. And you're not just going to be, screwed based off of your genetics. There is always going to be a reason, and there's going to be a solution. And in addition, if you were listening to me this whole time, what you realize is that none of this looks like a textbook. There's none of this you can read in a textbook. For those of you that are nurses, doctors, naturopaths, whoever, or maybe naturopaths, but like none of this is in the textbook. Nobody's telling you that your patient who has celiac disease might have formaldehyde toxicity. Nobody's talking about glyphosate. Well, maybe they're talking about glyphosate more these days, but nobody's talking about these connections. Celiac is, we don't know why it happens. There's no cure, but if it gets bad enough, this is what we can do to palliate your symptoms. And we need to not be settling for that. We need to be really advocating for ourselves to know that we deserve answers and we deserve solutions. And they are out there, I promise you. And some of you are here because maybe you tried functional medicine. Some of you are here because you have no freaking clue what functional medicine is. But I'm here to tell you functional medicine and integrative medicine are different, because functional medicine is better testing, but in my opinion, less tools. It's diet and supplements. Integrative medicine is going to be giving you a lot more tools. So I will answer that question, but you're going to have to get the replay. So one of the questions that they asked was about osteoporosis. And with the osteoporosis, this can definitely play into some of the things that we talked about, partly because these chemicals can block the absorption of calcium in the gut. But a big thing with osteoporosis is it's associated with your parathyroid gland. So again, if you're inhaling chemicals because you work in construction, you're being exposed to chemicals and fiberglass and spray insulation. If you work in a salon and you're getting exposed to aerosol sprays and things like that, then all of that that's going in is going into the lymph nodes of the neck. Your parathyroid, our glands is connected to your thyroid, and you can easily have dysfunction in your parathyroid based off of that toxicity, which will then compromise your calcium levels, which will then create more susceptibility to osteopenia and osteoporosis. So going back to this idea of functional medicine, integrative medicine, is that with functional medicine, it's great testing, but the solutions are focused on diet and supplements. When we get into this integrative medicine idea, we start to focus more on the bigger picture. Okay, how are we going to get rid of these chemical sensitivities? How are we going to get rid of the toxicities? Are we going to use detox therapies like infrared sauna? Are we going to use PEMF devices? Are we going to use lymphatic drainage? Are we going to use muscle work to get the lymph nodes moving? Are we going to use lymphatic massage? Are we going to use chiropractic? Are we going to use supplements? Are we going to use diet? So we start looking beyond and we start piecing it together so you get better results in a shorter amount of time. Because it's usually not just about, eat broccoli until you're green and that's going to detox your food, just one part of the puzzle. So we need to be pairing the food with other modalities that are going to give us the success that we're looking for, and we're going to give us this, or it's going to give us the success that is more sustainable. So another big thing that always comes up in conversation for those of you that are kind of new to this world is like, how does this all work with insurance? Because this all sounds great and I want this approach, but I want to use my insurance. And I totally get it. People pay a lot of money for their insurance. But I will tell you that the insurance model is going to keep you sick, because it's not focused on serving you as the patient. It doesn't allow us as the doctors to serve you as a patient. It really only allows us to serve their pockets. So when it comes to the way we work as a practice, it's all about you. It's all about giving you what you cannot get in other places. And we definitely work with insurance to a capacity because your blood work will go through insurance and you can use your out-of-network benefits, but we're not working directly with that insurance company because we're not allowing them to dictate what is best for you, because they don't know what's best for you. And at the same time, they have no idea. They're not in a model that it's about answers and solutions. It's in a model that we put the Band-Aid on it, we keep you kind of lingering, and we keep you coming back for more and more Band-Aid solutions, AKA more and more painkillers, more and more antispasmodics, more and more antibiotics, more and more whatever. But it doesn't give us a long-term solution to keep us out of the office moving forward. So when we're digging and we're really figuring out the big picture, we do a lot. And we do a lot more than the conventional functional practices. And we've evolved this over time, and we've evolved it because we've had to, because we know that things are complicated. We know that you deserve to have a coach. You deserve to have a doctor. You deserve to have a nutritionist. You deserve to get answers fast. You deserve to be able to look your doctor in the face and be like, holy crap, that makes sense. And that's really why I get up and do what I do every day. It's really why I do these webinars out of the kindness of my heart, is because I want more people to know about this. And yes, of course it comes with a price, but at the end of the day, you are going to have a team of people that are supporting you every step of the way. You're going to know exactly what's going on with you every step of the way, and you're going to have solutions that are going to get you to a place that you don't need us anymore. It's not that you rely on us for the rest of your lives. We get you to a place that you can sustain your progress. So that's really what the approach is about. And one of my absolute favorite components to this is something called the autonomic response testing. So what I found is when I was really functioning out of this functional medicine model, I was basing my recommendations off of what I thought was best. And most of your other physicians are doing the same. They're using subjectivity. Oh, I saw this work in a similar case, or the research says this worked for this. And really, at the end of the day, it's a bunch of guessing. Like, let's be real. It's a bunch of guessing. It's a bunch of trial and error. And unfortunately, it's at the expense of your wallet and your time. So I was tired of functioning that way. I was tired of doing it that way. And we don't guess, we test. And I love this about what we do, because I have the confidence in the testing to say, I know what supplements are best for your body based off of this test. I know what therapies are going to get you the best results in the shortest amount of time. I know exactly what your body needs to start healing. So at the end of the day, you're going to save so much time, money, and frustration. You're going to be able to accelerate this process. And for those of you that have been in the model, you know how you probably have the arsenal of supplements that is like $5, $6, $7, maybe upwards of $10,000 sitting in a cabinet of a bunch of things that you're like, I took it because it sounded good and then it didn't work. And you just like lose steam. You get frustrated, you get overwhelmed, because you're just like, I don't even know anymore. And literally, I will tell you this, I, at one point in time, probably had a solid $25,000 of supplements sitting in a cabinet in my house. And this is because before we discovered all of these advanced styles of testing, we were doing trial and error on ourselves as well. And it resulted in a lot of wasted time and a lot of wasted money. And I'm still chipping away at that lovely cabinet. I'm getting close to it being done. But, we've evolved our onboarding process over time, and we evolved it because we started to learn more. We started to challenge a lot of the conventional testing. We started to find better testing. We started to find ways to piece the puzzle together that literally allowed us to be like, holy crap. I see the big picture. I know exactly how this person got to this place, and I actually have a confident roadmap to get them where they're trying to go. And I will tell you, I have never been able to practice with such confidence until we started doing the testing that we do now. And, another big piece as to why we evolved this onboarding process is because I was also really tired of my patient coming into the office and, it's X amount of dollars for your consultation. And now I have to give you all these fancy kits because I need you to do a stool sample. I need you to do a nasal swab and a urine test and a saliva test. And all of these tests are $500, $600, $1,000, and they all rack up. And then all of a sudden you're, $1,000 in the hole, thousands of dollars in the hole. And we haven't even got to talking about how we're going to help you get better. So I wanted to find a solution that was really going to allow for people to get the most information in order to spend money on what I personally think is the most important, which is actually getting better. So really, at the end of the day, if you're the person that you're just like, I feel like crap. I don't know what's wrong with me. Nobody knows what's wrong with me. I've been on a merry-go-round of doctors, and a lot of wasted time and effort. Then, when you finally are able to pinpoint what is going on with you and what your body needs to get better, really, that is priceless. So when it comes to the layout of how our practice works, all of that stuff that I mentioned, so literally your own designated health coach, your own designated nutritionist, Dr. Nick or myself being your designated doctor. In addition, you get a team of 15 other people that are your support system through the process. You get all of your testing, your consultations, your report of findings, literally. You get so much under this category of our onboarding price. So those of you new to this world, you might be like, 1997, wow, I've never spent that much money on healthcare. Totally get it. I will tell you that. This is all has the ability to be reimbursed by your insurance company though. So if you have the out of network coverage, most people are getting reimbursed for definitely a huge component of this onboarding price. But again, there's no questions, there are no surprises. And I think that that's a really important takeaway, is that you're not going to get hit with surprise costs when you do this onboarding process, because everything falls under this bracket. In addition to that is family members at any point in time come for 50% off their onboarding. They get the same exact treatment that you did and the same exact team, but they do it at half of the cost. So we can really try to have this be more of a family affair, opposed to, only one person can come at a time. Another thing I always forget to mention is how all of our testing can actually be done long distance. So we work with patients at this point, I can't even say all over the country, it's really awesome, but all over the world right now. We have a couple of people that we work with in Italy. But with that being said, by simply sending us a hair sample, we can actually do a good portion of our in-house test through the DNA of your hair sample. And in addition to that, any blood work recommendations will be done local to you. And we will definitely have that fall in your in-network insurance and be able to leverage whatever coverage that you do have. So I'm going to just take a peek and see if we have any questions at this time. So I don't see any in there. I always say, I guess I did a good job if there's no questions. But if there's any questions that pop up in the next few minutes, definitely pop them into the chat box. But I really thank you guys for being here. I definitely absolutely love doing these webinars. I really feel that it starts with education. It also starts with being your own healthcare advocate, because there is so much mixed information out there. But, when you're able to actually get your own testing and understand more about your own body and what it needs, or what's going on and what it needs, that's really when you start to see your own personal breakthrough experience. And I really hope that the IWG team can be part of that breakthrough for you. So with that being said, definitely check out our website to learn a little bit more about who we are, what we do, how we work with our patients. We have some amazing resources and videos there, and we have an amazing client care team that does complimentary health strategy calls. So you can literally book one of those calls at any time, hop on a call with one of our team members to just really talk through the logistics of how we work with our clients and how we can best help you according to what you have going on and really what your goals are as well. So we do these calls just to always make sure that we are a fit for you as you are a fit for us. But we really hope to see you in the near future. And I always want to add in here how we have our Institute for Integrative Wellness. So this is actually for healthcare practitioners. So this is everyone from naturopaths to chiropractors to medical doctors, osteopaths, acupuncturists, even health coaches. It's an amazing platform for people to really learn more about integrative approaches to health and wellness. And it is literally a plethora of information, how to build your business in addition to how to really work with your patients from an integrative standpoint. So if you have friends or family or colleagues that potentially are a good candidate for that, definitely send them over the information for the Institute. All right, guys, I thank you for being here with me, and I will see you next month, actually. Next month, we're actually talking all about skin issues. So definitely bring your questions about skin issues and send your friends over as well. But I will see you next month.